When deciding whether or not to have weight loss surgery, your mobility status plays a very important role in this decision. Now, it should come as no surprise to find out that losing your mobility, being less able to walk around and to move, causes weight gain. I think all of us know this. One of the most commonly misunderstood concepts, and really most unfair concepts out there, is that if you had a procedure, an orthopedic procedure, or physical therapy, or recovered from your injury and regained your mobility, well, this would cause you to lose all of this weight. This is a very common discussion in looking at patients who are considering joint replacement surgery, thinking if they just proceed with that joint replacement, then they'll restore their mobility and then they're going to lose all this weight gain. What we find is that that's almost never the case. Weight gain that occurs as a result of a loss of mobility typically is permanent, and it's not fixed by regaining your mobility. And this is a very difficult fact for a lot of people to swallow, but I think it's really critical if we're going to make the right decision here. So the reason that immobility causes set point elevation is because when you become immobile, when you're no longer using all of your leg muscles and the other muscles involved in locomotion, which is really kind of all of our muscles, that you lose this muscle. And loss of muscle is one of the most powerful causes of set point elevation or weight gain. And again, when that set point goes up, then we find ourselves powerless to resist these physiologic changes of an increase in hunger and a slowdown in your metabolism. And this, to me, when I see a patient in the office and they come in with a cane or a walker, and as I kind of listen to their story, I hear about their progressive loss of their mobility and their function. I know that this really is an important factor in deciding on whether or not to have weight loss surgery. So how does this decreased mobility impact our decision? There's really two important things we have to consider. The first is getting back to this fundamental question when considering weight loss surgeries: do I need surgery in order to lose weight, or are there other means like improving your diet and exercise? First of all, when you have significantly limited mobility, exercise is out. It's just not physically possible to exercise, especially as we've talked about in some of those other videos. It really takes vigorous exercise, high intensity exercise. And so when I'm talking to a patient about that who has a cane or a walker, it's really kind of a waste of words, because there's no way that this patient is going to be able to participate in this level of exercise to drive weight loss. And because of the decreased mobility, because of the loss of muscle mass, it becomes really difficult to lose weight by any other means besides surgery. So limited mobility and obesity often require weight loss surgery in order to address the obesity. It's uncommon. I would never say it's impossible. And I have had patients who are 70-year-old women who use a walker who've lost 40 and 50, 60 pounds even on our nutritional program. So I don't want to say that this is impossible. But in general, when you have limited mobility, a weight loss surgery is really going to be your best option, or most realistic option for driving significant and permanent weight loss. On the other side, though, the other point is that having a mobility assist device, a cane, a walker, or the scooter, increases your risk of the surgery. So on one hand, you need the surgery more, but on the other hand, the benefit of the surgery is increasing, but also the risks of the surgery increase as well. And we know that mobility assist device approximately double the risk of short-term complications. When we think about surgical complications like leak and bowel obstructions and bleeding and things like that, it doesn't make any sense that requiring an assist device should increase the risk of these problems. These should be technical or surgical in nature. But what we find is that absolutely is the case, that higher rates of a separation of the intestine or a leak, or bowel obstruction, or bleed, or heart attack, or lung problems, or any of the things that can happen after these surgeries, it increases with the assist device. And it really increases as you move from a cane to a walker and to a scooter. Now, in general, my practice is to be very, very, very careful in operating on patients who have an electronic scooter as their mobility assist device. The complication rate in this group of patients is exceptionally high, and you really have to be very careful as you move forward with this decision. And what I'll typically do is I'll work with patients on good nutrition, and then also get them plugged in with a good physical therapist with our goal to kind of move you down one level of assist device. So if you're in a scooter, to get you to a walker. If you're in a walker, to get you to a cane. If you're using a cane, to get you to be able to walk without any assist at all. So the pre-op preparation for those with limited mobility oftentimes takes a longer period of time and requires more work than just the usual preoperative testing. So I think that's a really important component to think about. The risks of the surgery are higher, but also the benefits of the surgery are higher. And I really look at getting someone back to a good mobility status. And I've been through this at this point with hundreds and hundreds of patients. This is a 1-2 punch, that weight loss surgery is the first step. And then oftentimes an orthopedic procedure like a joint replacement or some type of tendon repair or arthroscopy or physical therapy, some form of orthopedic treatment should follow the weight loss surgery after the weight has come off. We know that joint replacements and other arthroscopic and orthopedic procedures have a much lower success rate in terms of getting people back to their level of functioning if there's significant obesity. To the point where in some countries like the UK, if your BMI is over a certain amount, they won't offer you an orthopedic surgery. In fact, their recommendation is a wheelchair. That's the treatment for debilitating arthritis in a patient suffering from obesity. Thankfully, in the US, we're not quite so limited. And what I find is that we start with the with the weight loss surgery, get you through that, and then once you've lost a significant amount of weight, then the orthopedic procedure is that second step, that 2 punch that's going to get you back to a reasonable level of mobility.